So good morning, everyone. Thanks for taking the time to come to Medicine Grand Rounds. Today, we're lucky to have Dr. Farouk talk to us, and I will turn it over to Dr. Wormer to introduce her.
Good morning, everyone. Welcome to our first virtual Grand Rounds of 2021. To kick off this year's series, we're very excited to be hearing this morning from Dr. Samira Farouk. Dr. Farouk earned her medical degree with distinction in research from Robert Wood Johnson Medical Center at Rutgers University, and then joined Mount Sinai for residency in internal medicine, followed by fellowship in nephrology, where she served as a chief fellow. After fellowship, Dr. Farouk joined the faculty and is currently appointed as an assistant professor within the Division of Nephrology, where she serves as an associate director of the Nephrology Fellowship Program and as social media director for the division. In addition to her clinical work caring for kidney transplant patients, Dr. Farouk conducts research into mechanisms of renal fibrosis and that may yield a prolonged transplant survival. And finally, as an educator, Dr. Farouk is heavily invested in teaching medical students, residents, and fellows, and is the recipient of multiple teaching awards at all levels. A very warm welcome this morning to Dr. Samira Farouk.
Thank you so much, Jim, for that introduction. And thank you, Dr. Thomas and Dr. Murphy, for the opportunity to speak to you all today about a topic that I've become really passionate about over the last few years. And as Jim mentioned, I was the resident here. It feels like not that long ago, I was sitting in the back of Hatch Auditorium. And so it feels a bit surreal to be speaking to you all today. And so with that, I will get started. And so unfortunately, I don't have any financial interest to disclose, but I am involved with several educational projects and initiatives that I will be discussing throughout the talk today. And to get started, COVID-19 has really turned upside down every sphere of our lives, not only including our social life, clinical care, research, and education has been no exception. And particularly, medical education has really felt a significant impact. And so if we do a quick PubMed search using the terms COVID-19, impact, and medical education, we would find a result that yields over 800 manuscripts. And these have been published within the last 8 or 9 months. And so clearly this impact has been profound and has been reported on by individuals from around the world. And so much of this impact has been a transition from in-person to virtual education using video conferencing platforms such as Zoom. And though we usually want our learners to have their videos on, unfortunately, sometimes they may feel like this. And so though this transition to virtual has felt a bit new and innovative and novel, this really is not something that really only started because of the COVID-19 pandemic. And e-learning is not new. And Elliot Massey, who is an educational technology expert, was the first to coin this term of e-learning, which he defined in 1999 as the use of network technology to design, deliver, select, administer, and extend learning. And so to put this into a context a bit, what was happening in 1999, we were all very scared about Y2K, what that would do to our computers, and was the end of the world imminent? And so obviously none of that turned out to be true, but just to make the point that everything I'll be speaking about today is really an evolution of an idea that had been started almost 20 years ago. And so the growth of e-learning really coincided with the increased use of internet, smartphones, as well as social media platforms. And this graph here on the y-axis is showing the percentage of adults in the US that are using each of these items. And on the y-axis here, we have, sorry, the x-axis here, we have the timeline. And so you can see that as of 2016, and these numbers are likely to be higher now, 88% of individuals in the US were using internet, 77% were using smartphones, and almost 70% were using social media applications. And so really almost ubiquitous use, and these numbers continue to rise as we move forward. In the last decade or so, there has been a real explosion of manuscripts describing the use of social media, not only in medical education, but also with respect to research and dissemination of research, as well as enhancement of clinical care. And so what do we do now? Everyone has smartphones, this field appears to be growing, and it seems that we're headed towards a future with more online and virtual learning. And so with that, here are the 3 objectives for my talk today. So the first is going to be to understand how social media and virtual learning tools can facilitate learning from a distance. The second will be to discuss the development and impact of free open access medical education tools, also known as FOMED. And finally, I hope to demonstrate to you the ability of social media to create robust, meaningful medical communities, and hopefully by the end of this, convince some of you to engage and use some of these platforms in your own teaching and work. So let's start with social media. And so for those of us that have been using social media since we were in high school, like me, social media really was a platform to really share what you were doing, and a bit of a narcissistic platform. So look at my picture from the beach, or look at this really cool thing that I did. And so when I was a resident, I have a really clear memory of when I was a resident in the medical ICU. I was in the middle of a 27-hour call, had nothing to do at 3 in the morning, and was browsing through Facebook and feeling really kind of upset and depressed about all of the different things that my friends that were not in medicine were doing. And that actually prompted me to delete my Facebook account. So everything I'll be talking to you about today is really a different use and a different angle of social media, and not really related to the personal uses that we may think about on a more day-to-day basis. And so let's take a step back, and what does social media actually mean, and what is the definition? And this is from Wikipedia, but I really feel like it does really describe very well what social media platforms are. And so first, they are Web 2.0 internet-based applications. And I'll describe to you in a minute what the difference is between Web 1.0 and Web 2.0. They facilitate the creation and sharing of content, ideas that can be exchanged. And finally, they facilitate the creation of virtual communities and networks. And I'm going to go through each of these 3 areas to show you how social media can really be a robust tool to enhance our education and lead us into more innovative educational approaches. So let's start with Web 1.0. And so if you can think back to when Internet Explorer first came out, these were really described as a mostly read-only web. And so what does that mean? That means that this content is being created by a very small minority of the individuals that are actually using these platforms. And so this content would be published, it would be then consumed by the users, and there was not really much room for back and forth dialogue. And these were not really dynamic platforms, and were actually very static. And so once something was published on the web, it was there. And even if those ideas had changed, there would not really be that much update of that content. Several years later, Web 2.0 became an interesting idea, and this was described as a mostly read-write web. There were many, many more websites like this. And what's really unique about Web 2.0 and why it is important for our discussion today is that you have a larger percentage of individuals that are actually contributing to the content that is published. So that leads to a higher volume of content. You do have consumers here that may not be contributing to the generation of the content. However, because of the way the platforms are designed, there is an ability for a back and forth, and this becomes a very dynamic platform. And so you can have individuals that comment back on the content, and there's really a free platform for exchange of ideas. So one example of Web 1.0 is Encyclopedia Britannica. I remember when I was in high school, I had a CD-ROM. I would put that into my computer when I had an assignment to do. I would see what the entry was about that topic, and then I would move on. And so because this isn't a CD-ROM format, obviously there's no opportunity to really change that in real time. And so there may be different editions of Encyclopedia Britannica that come out, but once it's on that CD-ROM, it really is a static Web 1.0 platform. And comparing that to Wikipedia, which is a more dynamic platform, Wikipedia entries can be updated regularly. And a nice example that I like to use is that one of my favorite sports teams is the Philadelphia Eagles, and within a few minutes of them winning the Super Bowl, their Wikipedia entry was updated to reflect that they had won the Super Bowl. And so again, Web 2.0, very dynamic, very current, and allows for dialogue and conversation among those that are using these platforms. So there are a wide variety of Web 2.0 platforms. You may be familiar with some of them. Each of them serves a slightly different purpose. For example, Instagram is a powerful platform for sharing photos. YouTube is more for sharing videos. Facebook has a combination of those things. And so I'm really going to focus on a few of these platforms today and show you how they can really enhance our educational environment and our medical communities. And so let's start with creation and sharing. And so creation and sharing in the social media space really refers to this concept of free, open access medical education, which is sometimes described as FOAM or FOAMed. And what are these? These are online tools generally, and they may range from blogs, podcasts, videos. And the idea is, as the acronym implies, they're free, can be accessed by anybody that generally has access to the internet. And the aim is to teach about something. And so because this is medical education, the tools I'll be talking about today are designed to teach different types of topics in whatever medicine topic of interest you may have. And so how did I become interested in this? And so some of you may know, and it's something that I talk about a lot, we have a problem in nephrology that we are unable to attract high numbers of applicants like some of the other internal medicine subspecialty fields. And so there was an interesting study that was done in 2013, which was a survey of internal medicine subspecialty fellows that did not choose nephrology. And so the authors of this study asked the question, why not nephrology? Something that I don't really understand. But what really came out of this study was that our patients are too complicated, the subject matter is too difficult, and notably, about 20% of these fellows said that it just wasn't something that was taught well. And so how can we take this, which is really an indication that our topic is not being taught well to our trainees that are potential nephrologists for the future, and teach this in a better way? And so this really makes a lot of sense if you think about how medical students are first exposed to nephrology. And this is a cartoon that was actually designed by a medical student at Columbia a few years ago that is widely circulated among the medical students here at Mount Sinai, that really shows in very granular detail all the tubule channels and transporters and electrolytes. And this is not really how we want early trainees that are being exposed to our field for the first time to experience what it is that we do and why we're so passionate about our field. And so I think this would be the natural response to this sort of graphic. And I'm really, many of you know that when I was in medical school, I actually wanted to be a cardiologist. And so this might have been one reason why nephrology was not attractive to me right away. And so can we replace this, and can we come up with a more engaging nephrology teaching tool? And can we create that so that it's free and open access and can be shared widely via social media to a wide audience? And so I was very lucky to collaborate with one of my colleagues, Rachel Hilberg, who was a former resident and chief resident here. She's now on nephrology on faculty at the University of Pennsylvania. And these are notes from our first meeting when we really wanted to talk about, can we make a website that's a better nephrology learning tool? And we thought about different strategies, and we thought about how we learn the best. And we realized that how we learned the best was from patients on the floor, and that's not a new idea. And so our concept was to create a website that would have case simulations or case journeys that would start from the patient's history of present illness, provide a physical exam, and then move on to providing an additional testing. Something else that we noticed was that when residents and medical students rotated with us on the nephrology services, they sometimes felt that nephrologists were called for acute kidney injury, and then they just ordered a whole slew of tests, and there was really no thought process behind that, and that we just did the same thing for everyone. And so what we wanted to do was to really emphasize the clinical reasoning process, taking into account the pathophysiological processes in nephrology, and teach those in an interactive and more dynamic way. And so I'll show you a little bit more what that looks like on our final product. And we also felt it was very important to encourage the learner to come up with a differential diagnosis early on. And so not that you get all the labs, all the data, you have everything, and then now at the end, it's very obvious what the diagnosis is, but how can you build your differential diagnosis with very limited information, and often just starting with the history and physical exam to get that thought process going and to see that there really is a method to why we do things the way that we do. And the final component that we initially drafted during our first meeting was that as soon-to-be nephrology fellows, we noticed that there were not really great resources for fellows and even nephrology attendings to get a good hold of nephrology pathology. And so we wanted to add in a teaching component into our website where we would show pathology images with labels to make that process a bit more transparent so that nephrology fellows and attendings could have better interpretation of pathology images. And so this turned into our final website, NephSim, and here is the final layout that we came up with. And so each of our case journeys is set up on average with 6 pages that range from the HPI, go through physical exam, diagnostic testing, all the way through to the diagnosis and conclusions page, where we actually go through the case step by step and explain how the clinical reasoning process could have been done given this data. And we try to keep it away from something like Up to Date that provides a lot of information about a broad topic, but really keep it very specific to this patient and how can you learn from this patient and what were the takeaways from this clinical, virtual, or simulation experience. And this is what our web pages look like. And so you can see again that we start from the history of present illness on the left side and progress all the way through to the diagnosis and conclusion page. And along the way, we have opportunities for the learner to engage and have some interactive and iterative feedback. So for example, they may be given a history and physical exam and then be asked the question, based on this presentation, what would be the next best test? And we provide them with 7 or 8 options, and then based on what they choose, they get some real-time feedback about, was that a good test in this situation, or was that a test that maybe is not as high yield in this situation? So this is our website, nephsim.com. This is what the platform looks like. We have designed this in WordPress, and WordPress is actually a very user-friendly web design platform that Rachel and I essentially taught ourselves over the course of a few weeks. And so initially we started out with focusing on these case journeys, and to date, we launched our website in 2018. We have about 51 or 52 cases. And over time, we realized there was a need for other nephrology educational resources that tackled some other complicated ideas in nephrology. And so you'll see here in our menu, we have a page for spin urine, and we realized that learning how to do urine microscopy was a skill that was really lacking among nephrology trainees and medical students and residents. Pathology 101 provides some guidance about how a trainee might approach a pathology slide. Acid-base provides one of our strategies to approach and solve acid-base disorders. And an area of our website that actually has become very popular is our image gallery. And so what we have in our image gallery is a collection of infographics. And infographics in the FOAMed space are essentially a one-page document that uses graphics along with some text to make a traditionally complicated topic seem a little bit easier. And so you'll see here we have a table showing the components of all the intravenous fluids that might be used. We have a guide to acute kidney injury and how one might approach that, and the different subtypes of membranous proliferative glomerulonephritis. And so these infographics have been incredibly popular. They are freely available on our website, can be downloaded as high resolution PDFs. And what's really most exciting about these is that in addition to being used personally by learners that may want to understand these topics a little bit better, they're very easily shared among smartphones, laptops, and can be even used as part of a presentation. For example, if you're giving a lecture to trainees about acute kidney injury, you might use one of our graphics as a supplement to your educational material. And so FOAMed is great, but where do we go from here? And so we made the website, we think it's really cool. And so 3 spheres that we think about when we're talking about assessment of free open access medical education are reach, usability, and impact. And so I'm going to focus first on the first 2, reach and usability, as we do have some data to show you how we're doing in those arenas. And so today our website has over 430,000 views, and those views come from over 100 countries. And this was something that was a bit of a surprise to us. When we first built this website, we really expected it to be used maybe within the United States, hopefully among the majority of fellowship programs. But because of our dissemination strategy, which mainly includes our social media account on Twitter, which has about 7,300 followers, and we were also able to build a robust email list of over 1,000 subscribers. And so whenever we have new content, we share this via our social media platforms, and we send this to our email list. And over the course of the week, we do regularly continue to share existing content via Twitter using our Twitter account. And so we've been really overwhelmed by the spread of the views here, and really exciting that we're really teaching nephrology in a way that we think is easier and more engaging to a very wide and global audience. And so how do people like our website? And so in 2019, we conducted a survey of individuals that had subscribed to our email list and asked them a few simple questions. Do you like using Nephsim? Do you think it's easy to use? And do you use it to teach others, or do you use it to teach yourself? And do you plan to keep using it in the future? And so with respect to usability, you'll see here that the majority of individuals who responded to our survey either agreed or somewhat agreed that Nephsim is easy to use. And of course, there is significant survey bias here. We did survey people that have already subscribed to our email list, but it was an indication that our website is easy to use. And we have taken a lot of feedback from our nephrology online community to try to enhance and optimize the workings of our website. And so How about impact? And impact is often the most challenging metric to assess in medical education, and FOMET is really no different. And so we've begun to approach this by collaborating with the medical school, and specifically the second year pathophysiology and nephrology course that is directed by Dr. Tonya Kim. And I was fortunate to receive a career development award from the American Society of Nephrology to really try to answer this question of what is the impact of this type of different nephrology teaching school for medical students that are learning nephrology. And so I'd like to share with you briefly our study design. And so for those of you that may not be familiar with the pathophysiology courses, many of them are designed in a lecture with small group discussion format. And so essentially after the students have lectures about certain topics, to have some more interactive learning of the material, they're put into small groups of 10 to 12 students. There's a preceptor that is generally a nephrology attending or a nephrology fellow, and it comes with a PowerPoint slide deck, and the preceptor goes through the PowerPoint slides and reviews various cases. And so for the second year medical student pathophysiology course, it really entails different types of glomerular diseases, acid-base disorders, and common electrolyte disturbances. And so what we wanted to do was see if we could incorporate NephSim into those small group discussions and teach the concepts in a slightly different way and see what is the medical student's response to that. And so you'll see here that the 8 small group sessions that are done normally, we split those into 4. And so 4 will be done the usual way, and this is to ensure that all medical students get the same experience. And 4 will be done using a NephSim inspired slide set, or even using NephSim itself as we think about moving to a virtual format. And this course is held generally in the spring. And we have a few interesting outcomes that we're excited to look at. And so after the medical students go through the course, we'll be holding focus groups with them to really try to understand, how do they feel about this teaching tool? Do they like it? Do they hate it? Did it make nephrology seem a little bit better? And does it make them think differently about nephrology as a field? And the more longitudinal outcome that we're looking at is, does learning nephrology through NephSim improve their retention of nephrology as they enter their 3rd year and start their internal medicine clerkships? So we know from data that Dr. Kim has shared with me that the medical students really perform really well on their final exam after the nephrology course. And so they get it. And so our goal is not to help them acutely learn that information better, but what we're planning to do is a nephrology retention quiz when these students are 3rd years, to show them and to ask them, how do you feel about nephrology now? And do you remember what you learned about a year ago? And is that different if you were a student that was learning with NephSim? And so I know that nephrology is not everyone's cup of tea. And so how can we take this template for our website and move this beyond nephrology? And so we've been very happy to be able to collaborate with several individuals, not only within Mount Sinai, but also Mount Sinai, to take our platform and our template and apply that to another discipline. And so the first one that we did was a collaboration with Dr. Nisha Chadha, who's an ophthalmologist and medical educator at Mount Sinai. And she similarly wanted to improve teaching for ophthalmology. And initially she had a project idea to teach ophthalmology better to medical residents, internal medicine residents who really did not have a good grasp of basic ophthalmology information. And so how we did this was we were able to essentially copy our template from WordPress, put that into a new website. I was able to train Nisha on how to use WordPress. We came up with a logo, and she is now has been building cases for the last year or so, and has really gained a nice base of users that are trainees interested in ophthalmology, as well as ophthalmology attendings. And so we've done similar work with Laura Stein to create NeuroSim, which is being used in their residency. I was connected with one of my nephrology online collaborators, Matthew Sparks, with a resident at Duke, Stacy Bargova, who is about to start her rheumatology fellowship, and she felt very passionate about improving how rheumatology is taught. And most recently, we began a collaboration with Bhavana Rao and Bridgen Shah from gastroenterology to create GI Sim, and we were fortunate to receive a small grant from the American Gastroenterological Society to fund this project. And so we're hoping to continue this expansion. There are many, many subspecialties that remain, and all we really need is someone that has an interest in this area and wants to build cases and share educational content. So FOMED is not just limited to websites. NephSim is merely one example of the many different types of FOMED platforms. And this timeline here that goes from 2006 to 2020 shows the evolution and growth of FOMED projects in really only in nephrology, and we've really become a leader in this field, and we're looking to expand what we've learned from our experiences to other specialties, as we do believe that these are really powerful platforms and that can really help learners, particularly with topics that they may find traditionally challenging. And so you'll see up here not only websites and blogs, but also podcasts, videos, as well as conferences and virtual lecture series. And so I'm very happy to be a part of a group of individuals that work on these projects, and I'll speak a little bit more about how I got to know them and how we work together towards the end of the talk. So I'd like to switch gears a bit and now talk about the use of social media to create virtual communities and networks. And so why does community matter? And so if we look at the definition of community, there are a few different ones here, but really the takeaway is that it's a group of unified individuals that have a common interest. And so for purposes of this, we might be talking about a professional interest or an interest in a particular medical topic. And so there's always a need for community. And I think most people that are part of communities, whether they're national communities or something like a social media community, would say that they've benefited in some way from having those networks and ability to collaborate and work with other individuals that are trying to do the same things that they are trying to do. And so of these social media platforms, almost all of these create some sort of community, but the community that I'll be focusing on is Twitter. And Twitter has become really a large meeting place, an international meeting place that allows for the exchange of ideas between not only medical professionals from around the world, but also patients and anyone else that may be interested in being a part of the conversation. And so can we use Twitter to teach? I've spoken a lot about how we use NephSim to teach and how we use Twitter to share NephSim. And so absolutely Twitter can be used to teach. And some of you may have heard of this term called the tweetorial. And a tweetorial is essentially a thread of tweets that someone shares through a social media Twitter account. And they use these series of tweets to break down a topic that otherwise may be a little bit more complicated. And so you can see here, we have a tweetorial that we shared from NephSim's website, in which we walk through an approach to understand acid-base disorders. And so this is tweet number 1. And you can see here that we've used a poll, and polls are a really great way to increase engagement among learners or anyone that is consuming this content on Twitter. And so after the tweetorial, we wondered if using Twitter to ask individuals acid-based questions as kind of a quiz, and then come back in a few days and answer that question might be an effective strategy to teach what is really thought to be a very challenging topic for not only nephrologists, but other individuals that are taking care of patients in the clinical setting. And so we analyzed our data over the course of several months, during which we shared 20 of these acid-based Twitter polls. And you'll see that there was a very high engagement. On the left side here are the number of responses. And one of our polls actually received over 600 votes. And so, of course, we don't know who these individuals are. We assume that they're people that have some interest in learning about acid-based disorders. And then you can see here, the gray line shows you the percentage of correct responses per poll. And so we've been able to get some interesting data about what types of acid-based disorders learners may find a little bit more challenging. And that has really helped us to continue to create and curate our content for the future. And an important gathering for nephrologists on Twitter is really this online journal club that was started several years ago by 2 nephrologists that is called NephJC. And so the hashtag is here because on Twitter, when you use a hashtag that essentially groups your tweet into a certain category. And so if you're having an online discussion, everyone uses that same hashtag so that the conversation can be more easily followed. And so when NephJC was started, the goal was to create a nephrology journal club that uses Twitter to discuss the research, guidelines, and editorials that drive nephrology. And this is one of my early entrances into the nephrology social media space. And this is a journal club that meets twice a month. And so every 2 weeks, I join Twitter. It's usually on a Tuesday night at 9 p.m. All of my colleagues from around the world that I've met are there, and we discuss what are thought to be high impact journal articles or topics that are really relevant in nephrology in the current moment. And so most recently, we discussed a paper that was actually published in the New England Journal that looked at the impact of the use of belimumab on patients with lupus nephritis. And so as a part of this online journal club, not only do we discuss the paper, but the discussion is preceded by curation of content to, again, make that article a little bit easier to understand. And so on our NephJC website, we have an article summary, and that summary also comes with a visual abstract. And so you'll see the visual abstract over here. And what a visual abstract is essentially what it says. It's an abstract, but instead of words, you're putting in some pictures to make that a little bit easier to understand. And so I haven't looked at this study since we talked about it at the end of November, but I can tell you just from looking at this visual abstract that it included 448 participants who received a placebo or the study drug, belimumab. And here I can see the percentage of individuals who had a partial or complete kidney response. And so NephJC has become a powerful tool for us to come together to not only collaborate with one another in any common interest that we share, but also to critically discuss important research that is coming out and talk about how that impacts our patient care. And another huge benefit of this is that the article authors will often join us for the chat. And so it's a really robust experience to be able to ask an author directly, why did you choose that database, knowing XYZ limitations, and to hear what their response was and what was their approach and why did they design that study the way that they did. And we're not the only ones that are doing online journal clubs, so nephrology can't take all the credit, but whatever your area of interest may be, there's likely a journal club for that. And so you'll see on this slide the widespread of different journal clubs. And this also allows room for really exciting collaboration. And so we have done in the past joint journal clubs with, for example, with rheumatology. Obviously, we have a lot of overlap with some of the disease processes. We've done a joint journal club with the dermatology journal club before. We discussed a paper of skin malignancies in patients with kidney transplants. And so the opportunities for collaboration are really endless. And as long as you come to the table and are eager to participate and collaborate, there's probably something there that you can benefit from. And so how does this all relate to COVID-19? And so I've just described to you this very robust community that has been really growing over the last several years. And so how did this community come together to battle the COVID-19 pandemic? And so this is an article that was published in Science magazine in May, and I find it very striking, and this likely has gotten, these numbers have probably gotten even higher, but this quote from this article says that by one estimate, the COVID-19 literature published since January has reached more than 23,000 papers and is doubling every 20 days, among the biggest explosions of scientific literature ever. And so one NephJC unfortunately cannot cover all of this. And so we needed a way to be able to synthesize all of this information and present it in a way that was readily consumed by nephrologists from around the world so that they could use that to provide the best patient care that they could to patients with this devastating disease. And so we used our NephJC website and capitalized on the platform that we had already had. And we built a website that really covered different topics important to nephrologists and how those topics related to COVID-19. And so you'll see here on the right side here, we had a page for COVID-19 and transplant, COVID-19 in pediatrics, dialysis and CKD, acute kidney injury, and of course, we were very excited to learn more about the ACE2 and hypertension story and what we should be doing with RAS blockade like ACE inhibitors. And so each of these pages was put together by individuals that are a part of our NephJC community that have some expertise in this area. And so I, for example, contributed to the transplant page and was a part of the process of reviewing these articles, summarizing them, putting them into tables, and trying to draw some conclusions during a time when individuals taking care of patients were very, very overwhelmed with the plethora of information. And so this allowed for really a global opportunity for collaboration, again, with the end goal being to provide the best patient care that we could in a very evolving landscape. And so we did have an NephJC chat that did not talk about one article, but the idea was for all of us to come together for 1 hour to just talk about how things were going and what we were learning and how could we help other nephrologists in other parts of the country. And I do want to mention that all of these tools we do take very seriously, adhering to HIPAA guidelines. We do not share any any protected health information. And you can see here, there's several tweets here talking about how dialysis patients were being isolated, how individuals were trying to transport patients from dialysis to their homes and back, and just any advice that anybody had as we were all just really drowning, particularly with the very high rates of acute kidney injury and the very high burden on dialysis. And so during the peak of the pandemic, we were preparing or thinking about preparing for a conference that has been held for a few years now called KidneyCon. And we developed KidneyCon a few years ago because we wanted to develop a conference that was really more for trainees with a focus on education. And one of the highlights of this conference were these hands-on workshops during which we would break up participants into small groups, and they would have an opportunity to actually do something and maybe learn that concept a little bit better. And so one of those workshops was a very popular kidney pathology workshop, as there's a very large nephropathology lab in Arkansas where this conference is traditionally held. And so of course we had to cancel our in-person conference, and we were thinking about opportunities to make this virtual. And the idea that we came up with was, can we take advantage of Zoom and the screen share function and somehow teach our conference attendees still about kidney pathology through the microscope, but have it all be virtual. And that's when we came up with this idea of KidneyCon Lite. And so instead of our KidneyCon conference, we had a virtual kidney pathology workshop where participants joined the Zoom meeting. Our nephropathologists had their microscope that was screen shared through their Zoom, and they were actually able to teach us in real time what they were seeing on the slide. And in some ways, this was actually more robust than having an in-person session, because Zoom has the annotation bar where we can circle things. There's a chat box that allows for potentially enhanced engagement. And so our first session went so well that we actually turned this into a monthly virtual conference that's still happening. And you'll see here that on our first session, we reached the Zoom max, given the account that we had, of 300 participants. And these participants came from continents and countries all over the world. And so again, a very robust opportunity to be able to really create this global classroom and take advantage of a need to use virtual learning tools. We did a similar approach actually within the residency program here, and we thought of the idea that since we're able to share what's under the microscope and teach this via Zoom, can we do this for another topic like urine microscopy? And so what we actually did was, we have a cell phone in our urine microscopy room that some of you may have seen. And on this cell phone, like many of you have on your own mobile devices, we do have the Zoom app. And so we can actually directly share whatever we see under the microscope with everyone that's on our Zoom call. And so we didn't want to burden the residents. And so we did do a needs assessment survey first. And so and some of you may have participated in that study. And we asked a few simple questions. We said, have you ever done urine microscopy before? The majority said no. Are you interested in learning urine microscopy? The majority said yes. And finally, do you think that urine microscopy is important for you when you take care of your patients with AKI? And the majority, over 95%, also said yes. And so then what we did was similar to the monthly virtual pathology conferences. We began virtual urine microscopy sessions, which Ali has been very instrumental in helping us do for the residents. And you'll see here what the Zoom screen looks like. And what I really find most exciting about this is that we're able to use the annotation bar to circle different elements that we see in the urine microscopy sediment. And so I remember when I was a nephrology fellow in the urine microscopy room with my attending, and we would kind of be going back and forth. Well, do you see it? It's kind of at 3 o'clock or a little bit to the right. And there was really never a way to kind of clearly identify, are the educator and the learner, are you looking at the same thing? And so the annotation bar is a benefit of these video conferencing softwares that allows you to say, here's exactly what I'm showing you, and this is what it is, so that you will be able to recognize it in the future. And so we've been very happy with how these sessions have gone, and we're looking forward to continuing them in the future. And we really hope to kind of share a little bit about urine microscopy with internal medicine residents. And so everything that I've showed you, I think, has really confirmed this idea that yesterday's classroom really has turned into this much more global classroom where we have people that are connected and networking from around the world. And so I've showed you several projects so far, and hopefully you're having some fun and excited about them. But if you're not, we still have a little bit more. And so a couple of nephrologists in 2013 came up with a way to take advantage of gamification, which uses a game to increase engagement and participation to ultimately teach a nephrology concept. And so we modeled this game after the popular US men's college basketball tournament, March Madness. And as I'm sure many of you know, how March Madness works is that basketball teams that come from different regions, East, South, Midwest, and West, are pitted against each other in a bracket. And for anyone that participates in March Madness, you fill out a bracket with the goal being to try to predict who's going to win. And the more predictions you get right, the more points you get. And ultimately there is a champion that is crowned. And hopefully there are some prizes that are involved to keep you motivated. And so with that in mind, Neph Madness was born in 2013, and this was developed by two nephrologists, Joel Toft, who's in Detroit, and Matthew Sparks, who's at Duke. And their idea was, instead of basketball teams, why don't we take relevant nephrology topics and pit them against each other? And instead of regions, East, South, Midwest, let's come up with broader nephrology topics. And so you'll see here in this bracket that there's 8 regions. And so for example, we have hyperkalemia, transplant, vaccine, and of course, our favorite SGLT2 inhibitors. And within each of those regions are 4 teams or nephrology topics that are interesting, and there's something that participants can learn from those topics. And so how do you fill out this bracket, and how do you know who's going to win, and how do you choose your Neph Madness champion? And so our goal is to teach participants about these topics. And so what we come up with as a Neph Madness planning committee are blog posts that review each of these topics and try to essentially prove why they are important and why they are so impactful in nephrology. And these posts are written by members of our Neph Madness team, along with experts in this field, to ensure that we have accurate content. And in addition to these blog posts, we have podcasts that also discuss some of these topics and controversies, and also visual abstracts that I showed you before. And so when this game starts, it's really an explosion of FOMED, and provides a lot of opportunity for not only nephrologists and nephrology trainees, but other clinicians and patients and anyone that's interested to learn a little bit more about some of these topics. And so who picks the winning bracket? We choose a blue ribbon panel of experts, and you may notice a couple of the individuals here. And we choose these individuals based on their experience with different nephrology topics. And we really believe that everybody wants to try to predict what the blue ribbon panel's picks are going to be. This is a very secretive process. Our blue ribbon panel is sworn to secrecy as they select the winning bracket before the game begins. And so in 2020, we were very excited, despite being at the height of the COVID-19 pandemic in New York City, to break 1,000 brackets that were submitted. And you'll see that since Neph Madness began in 2013, we have had significant growth. Unfortunately, that was impacted by COVID-19, but we are hoping that this year and that the numbers are going to be higher than they have been before. And these bracket submissions, again, like all the other content I've discussed with you, come from around the world. And so we're trying to promote exchange of information and learning of these topics that we feel are relevant within nephrology. And so this leads to a lot of other opportunities for engagement and participation. And so you'll see here is a picture and a tweet from when we as a fellowship program submitted a bracket together. And so we encourage not only individual bracket submissions, but group submissions. And so this was a really great fellows conference that we had when we discussed all these topics. You can see the bracket drawn on the whiteboard. And ultimately the winner that we chose for that year was preeclampsia. And again, this is also happening in other fellowship programs, not only in the United States, but also around the world. And the most fun part for Neph Madness for me is the conversation that happens on Twitter. And so everyone uses the hashtag Neph Madness to share what they're learning, to learn from other individuals, and maybe most importantly, to brag about how their bracket is doing. And so just like in March Madness, when after every round of play, there's an update of the scores, we similarly have an update of our scores based on how your bracket performed against our blue ribbon panel. And I want to point out that this is not only nephrologists that are participating in this. We do have individuals from other specialties that participate. You'll see that a hepatologist filled out a bracket, and you can see here he's telling us a little bit about his team of choice. And another hashtag that comes with Neph Madness is the hashtag Blue Ribbon Fail, which has become very popular if you disagree with our Blue Ribbon panel, but the Blue Ribbon panel will generally be there to tell you that they are correct, and they will generally try to explain why they are correct and why you are wrong for filling out the bracket the way that you did. And we're very happy to see that the madness is actually spreading. And so our colleagues in rheumatology and oncology have also adapted the format of our game and have begun to do similar educational efforts within their fields. And so I can't believe it's almost March, but our brackets for Neph Madness are going to be dropping on March 1st. And so we keep all of our regions and topics and on our Blue Ribbon panel very much under wraps. And so the big reveal will happen on March 1st. And so for anyone that's interested, you can find all the information at AJKD blog. And I want to spend the last few minutes talking about two mentorship programs within the nephrology space that I'm a part of. And so again, coming back to this survey where we look at why internal medicine subspecialty fellows don't choose nephrology, over 30% said that they had no role model or mentor to guide them towards nephrology. And so one important mentorship program that I'm a part of is the Nephrology Social Media Collective, which is a group of individuals that not only are very interested in the creation and sharing of free open access medical education, but also really care about effective social media use and optimizing and teaching modern communication skills. And so this is a group of nephrologists from around the world again, and really I think we're just a big group of nerds that like to have a lot of fun and have a lot of common interests. And an important part of our collective is an internship training program that began in 2015. And the goal of this internship program is to provide other nephrologists, fellows, attendings, or anyone from another specialty that might be interested to learn how to take advantage of some of these social media skills. And so how do they participate in an FJC conversation? How do they host an FJC conversation? What is a tutorial and how can you make one? What is a visual abstract and how can you make one? And you might want to make one to share your own research a little bit better using social media platforms. And we also have a series of open mic night lectures where we have individuals that are experts in certain areas that come and talk to our interns about whatever area their expertise may be, whether that's web design or development of different free open access medical education tools. And so over the last 6 years, we've graduated 6 classes of interns, and I was very lucky to be a part of the 2018 class that I did just as I was finishing my fellowship. And this has really been a really exciting opportunity for me to be able to immediately have a very large network of collaborators, not only within the United States and in New York, but also around the world. And they have really been instrumental to some of the work that I've been able to do. And I think to be in the same virtual room with people that care about things the way that you do and have the same goals as you do is a really, really important way to try to enhance your chances of success. And finally, the last thing I wanted to talk about today is a new program that we've actually just launched this month, which is a new global virtual mentoring program for trainees. And so the Nephrology Social Media Collective provides a nice mentoring environment for those that are a little bit further along in their training, but there really isn't anything that is a longitudinal experience for trainees that may not be committed to nephrology yet, but might have some interest in learning a little bit more. And so what we've decided to do is pair a group of volunteer faculty mentors, again, individuals that I've met from around the world, and each of those mentors is going to be paired with a group of trainees, medical students or residents. And the goal is going to be to provide opportunities for longitudinal engagement, communication between mentors and trainees, as well as mentoring. And we also hope that the trainees will be able to engage with each other. And because of the low number of applicants in nephrology, sometimes a resident that may be interested in applying to nephrology may be the only one at their institution that is doing so. And so that can be a bit of an isolating experience. So to be able to connect them to other residents that have similar interests, we think may be an important experience. We've planned a year-long curriculum of educational sessions. One will be held every month or every other month virtually, and we will also have career panels to share with trainees what are the diverse opportunities of careers that one can have as a nephrologist. And so we were overwhelmed to receive 400 applications for this program in December. We selected about 100 of them, and this is our NephSim Nephron class for this year. And we're very excited to be able to welcome them. We're actually having our first welcome meeting with them tonight. And they are medical students, they are residents, they are postdocs who are thinking about nephrology training sometime in the future, and they come from all around the world. And so we're very excited to share with them a little bit about what our field's about. And I'm very happy that there are a few students and residents from our own institution that will be participating in this program with us. And here's the group of faculty that will be mentoring them. And again, these are individuals with very diverse backgrounds and interests. We have private practice nephrologists, physician scientists, clinician educators, but what they all have in common is a real passion to share nephrology with these trainees and get them excited about what it is that we do, and hopefully someday come and join us. And so in summary, I believe that FOAMed provides opportunities to reach a global audience while innovating and enhancing learning platforms. I really do think that social media is a powerful tool for the creation and dissemination of information. And finally, when it's used thoughtfully, social media, I think, does have the power to create robust and meaningful communities and foster collaboration. So I want to come back again to Elliot Massey, but share a different quote this time, which really resonated with me, which he said, and this was again sometime around 1999. He said, "We need to bring learning to the people instead of people to the learning." And I think that is really the underlying concept of the entire FOAMed space and the FOAMed movement. And so it's not Y2K anymore, and we may have other problems that we're trying to deal with, but I hope that this educational space will continue to innovate and move forward in the future and be able to involve as many individuals as we can in the process. And so with that, I want to thank, my Mount Sinai family, and of course, the Division of Nephrology, my mentors going back to my residency, Dr. Silmy, Dr. Murphy, and then my global nephrology family that I have really met and worked with over the last few years that have shown me the social media ropes and have mentored me and given me the tools to build my own educational tools and share those with the world. And so again, I'll end there and just wanted to say thank you one more time to Dr. Murphy for giving me the opportunity to spend some time on this work that I'm so passionate about. Big thank you to Dr. Thomas, who served as a mentor for me. He is a mentor for me on the grant that I received, and also has been a huge proponent of my work in medical education. And Dr. He, Dr. Kim, and Dr. Campbell, who I think may have been one of those mentors that did convince me to pursue a career in nephrology. So I will stop there, and I'm happy to hear questions, comments, or thoughts from you all.
Thanks so much, Dr. Farouk, for an excellent presentation. There's one question so far in the chat, and folks can either unmute themselves and ask questions or enter them in the chat. But the first question commended you for a superb body of work and asking what platform you're using for NephSim.
Yeah, thanks for that question. So we're using WordPress, and so it's essentially a free platform that hosts websites that anyone can really design. And so there are different levels of WordPress that you can subscribe to have additional features. And so we use a paid version of WordPress.
Other questions? I guess I have one, Dr. Farouk. So one question is regarding academic productivity, right? For junior faculty interested in med ed applications on social media. Is that accurately captured, do you feel, in the traditional sort of promotion standards, and what more work needs to be done there?
Yeah, that's a great question. And so I didn't mention it in this talk, but there actually has been a lot of discussion about how does this sort of work translate into tenure and promotion, and kind of what does it mean? And so different institutions have begun to adopt social media work as being appropriate as part of a productivity metric. And so there are published recommendations about how this sort of work should be captured. And so some of the guidelines actually from the ACGME are that this work needs to be original, it needs to be archived, it has to be disseminated, and importantly, there has to be a way for a back and forth feedback system. And so to ensure the quality of the work that's being produced. And so what might you include on your CV might be, for example, if I have NEFSIM on my CV, I would include the number of cases, the number of views that I have per month, where those views are coming from. And again, the real goal is to show quality and to show impact. And so whatever way that you can do that for these different types of projects, that should be acceptable. And Mount Sinai is an institution that does recognize social media work as part of productivity.
Thank you. Other questions? All right. If not, thank you so much. Very nice work, and nephrology and med-ed are better for your excellent productivity and work in this area. Thank you.
Thank you.